So, could you tell me your name, where you're from, and your background?
So I'm Satish Gopal. I'm a oncologist and an infectious disease doctor from the University of North Carolina. I work in Malawi. We have a long-standing clinical research collaboration there, so I live and work there and lead our cancer program. Yeah.
Great. So, how did you first become interested in Castleman disease?
So we recently reported what I think is the first confirmed MCD case, HIV-associated MCD case from sub-Saharan Africa in the Lancet a few weeks ago. Um, so I think, it's long been it hasn't been clear what the burden of MCD in sub-Saharan Africa is, where
Yeah.
I principally live and work. KS is a huge burden. MCD has not been very, really identified. It's been unclear whether that just reflects lack of awareness and underdiagnosis, or whether it reflects some biologic reason that even though KS occurs in overwhelming numbers, MCD somehow is not occurring. We have, among many of our activities, an ongoing lymphoma cohort study where patients with suspected or confirmed lymphoma get enrolled into a prospective observational cohort. In that exercise, we have now identified 5 cases of MCD,
Oh, wow.
all HIV associated, all KSHV associated, which, and again, recently reported what we think is the first case in the Lancet, and now have a sort of a submitted case, sort of report, case series, which again I think is the first case series from sub-Saharan Africa describing this entity, which in my opinion it clearly occurs with appreciable frequency, but has just been under-recognized in that part of the world.
Right. So then, how did you get introduced to the CDCN, and what
So,
important role is it going to play advancing research going forward?
so after we published our case in the Lancet, David contacted me. I had not been aware of the CDCN prior to that, but again, I think I likely happen to work and live in the part of the world where MCD occurs with highest frequency, even though I think for a lot of reasons that has been under-recognized. So when he contacted me after this recent experience, I thought it would be useful to come and see what's going on in the network and what opportunities for collaboration would be.
Yeah. What sort of new advances or research you're working on are you excited about going forward with Castleman disease?
So again, I think we're at step 1 in sub-Saharan Africa, which is simply to identify how frequently it occurs and what the characteristics of the disease are there that may or may not be different. Again, in a relatively limited experience, we've found that we can find cases for sure. They're all misdiagnosed as other things before they come to us. I think the pathology infrastructure to make the diagnosis in sub-Saharan Africa is often lacking, as well as recognition of the disease overall. So, in some extent, we're just trying to establish a baseline of how much MCD there is. Our patients with MCD have done disastrously poorly in sub-Saharan Africa because treatments are not available in that part of the world, and the acute care is also rather poor. So we've had a very high mortality rate among the cases that we've identified. So, I am particularly interested in the care of cancer patients in sub-Saharan Africa, which is most of what I spend my research time thinking about and clinical time doing. And so I think, MCD is an under-recognized entity there that I think it'd be useful to try to, more systematically figure out how much of it there is, and how to address it in resource-limited environments.
Right.
Which is where it probably occurs more frequently than anywhere else.
And then what would you say to other researchers that want to get more involved, and then also to patients that are maybe recently diagnosed?
Well, I guess it's a little hard for me to speak to people who are seeing people in the U.S. I think, it's obviously a rare disease, and I think the CDCN is important to try to, unify efforts to address it. But at least there are people here and therapies available. Again, most of my mental energy is focused on a part of the world where resources are very scarce.
Right.
But again, I think the irony is that without people realizing it, that is probably the part of the world where MCD is most frequent. And so, I think for I think there are potentially opportunities there to study, what we think of as an uncommon disease in a part of the world where it's more frequent, where obviously questions can be answered in more definitive ways. Although, again, I think where things are currently, how much MCD there is really not well known, and there are very little resources to diagnose and treat it properly. So, but if we're, I think, willing to make investments and focus on that part of the world, it can probably inform the larger Castleman's disease agenda rather in important ways, I would say, that theoretically would benefit patients around the world.
Wonderful. Thank you so much.
Sure.